Welcome to Kevin Richards VIPs. This week's guest is a fascinating man, local artist, family man, entrepreneur, motivational speaker, and psychologist. This week, we turn the tables and I get to interview Dr. Ken Marek. I'm sitting here in the beautiful garden at the home of Ken Marek. Dr. Marek, welcome to the show. Glad you're here. Well, I'm here.
Thank you.
Dr. Marek, there's so much to know about you, so I'm just going to kind of jump right into this right away. So let's just get to know you a little bit first, and then we'll talk about some of the things you've experienced in your world of being a psychologist.
Okay.
So first thing, let's just start off with where are you from?
Well, I originally started off in Toronto, right down on the waterfront, Front Street in Spadina, living with my parents, and she ran a short order kind of luncheon bar that was open from around 6 in the morning till 2.
Nice.
So I remember those memories. And then around age 6, we moved to Arundel, which was near Oakville.
Okay.
And then from there we moved to Belleville, where I finished my high school. Once I finished high school, I was off to the University of Waterloo. I actually started out my career as an architect.
So let's back that up again. So an architect. Where'd you go to school for that?
Waterloo.
Okay. And why architect?
Because I'm a natural artist. And my uncle, here's how my decision was made this quickly. My uncle said, you're an artist, you like to draw, you're creative, go into architecture. I had 5 other choices. But I said, okay, sounds good.
Do you know how many people would like to have a parent that says, no, don't do something realistic, go be an artist? Not a lot of people get that sort of opportunity. That's something you can embrace, especially as an architect, right? So let's go on from there then. You somehow went from architect and then decided that you wanted to become a psychologist.
Well, I found architecture too conflictual. There was too much criticism of your work, and you had to have a thick skin. And the responsibility of a building on your shoulders, like you were basically responsible for everything, I kind of didn't feel in place. So I took a year off, sold real estate in Toronto of all places.
Yeah. And
then started the journey of finding where I really want to be. So it took 2 years. I looked at the ministry, I looked at church work, I looked at counseling, and then I slowly started drifting over. I want to be a youth worker. I want to work with kids. And I saw movies where these guys would take these kids out of the gutters and clean them up. We did one summer working for the Catholic Children's Aid in Hamilton. We figured, no, that's not where we're going.
But that whole idea of rehabilitation is something that not enough people embrace, right? And maybe this is a little controversial, but you think about how many people medicate and they don't get into the mind, right? Yeah. And there's so much medication out there. No offense to medication, because if it wasn't for that, people could still have polio and all kinds of things, right? But on a psychological aspect, getting into people's heads is a great way to heal them.
Well, but the only thing that we have to recognize, it takes time. Whereas a pill will go instantaneously take away the symptoms. Therapy takes time, and you got to be willing to journey 1 or 2 years sometimes less, sometimes more, to really find out what you're all about. And once you discover who you are and what you are here for, then life starts to change.
Mm-hmm. So then what was that leap into psychology then? You wanted to do what?
Well, I kind of just wanted to help people. I found that people would gravitate toward me. It seemed like I was giving good advice, but I knew I needed more than that. You just can't be a good advice giver and help people. Mm-hmm. There's so much more involved. You've got to think of so many different things when you're dealing with an individual. So basically, I narrowed down what I do to this. I'm a psychologist who takes people out of the potholes of life and puts them on the stepping stones of potential success.
And that's a great thing to live by.
It covers everybody.
Yeah,
because,
absolutely.
I'm giving you a stepping stone. Whether you step on it or not, that's your choice. But here, these are things that potentially can ultimately help you be successful, whatever you think that means in your life.
And that's a lot of respect for that too. So good for you for doing that, because everybody, no matter what they think, everybody needs a little bit of sanding. Some people need a little bit of chipping away.
Yeah.
But to get there, it helps to get inside the mind.
Yeah.
Right? So where did you go to learn about psychology?
Well, I first started because we were very strongly involved in our church. They had a seminary in South Dakota, Sioux Falls. So we just, again, my wife and I are both somewhat impulsive. Someone said, there is a seminary, they got an MA in counseling. We're going. We just packed up and left. So we went there for 2 years, got our degrees, graduated together. She got fed up then of schooling. She said, I just don't want to see another book.
Yeah.
I've always had a passion from as far back as I can remember. I want to be a doctor. Well, when I was growing up, doctors just meant medical doctors. Then I realized there were zoologists and all these other doctors out there. But then I gravitated towards psychology and said, I'm going to be a doctor. I'm not going to stop at an MA, so I just kept going. So I went to the University of South Dakota, finished my degree in doctor in education, counseling, and clinical psychology. Came up to Hamilton with my wife where her parents lived, worked for 5 years.
Yeah.
And then there was an ad for a psychologist in Barrie at the hospital. I took it.
So you started off at RVH, the old RVH, too, down on Victoria Street, right, or whatever. So when you're now at RVH, what's the job like? What are you seeing patients on a daily basis? Are you studying people throughout the day? And part of my ignorance on it, but not everybody quite understands what a psychologist does completely. Luckily, in my life, I haven't had to go for it. And forgive me, you may be totally evaluating me here right now. You're gonna leave here and go, guess who just interviewed me? This guy's got problems. So you can tell me a little bit about what RVH was like back then too, because this was when, in the 80s?
Well, I went there from Hamilton. I worked from 79 till 83. 83 to 88, I worked at RVH, and then I got fed up with the system. I've always wanted to be my own person. The conflict, for me anyway, and maybe it was a lot of psychologists, is that the medical profession dominates. So you got psychiatrists dictating everything. Mm-hmm. You're there to do some assessment, give them a little spiel, and then they look at it and go, oh, thank you. And a lot of them just file it. So it's on the chart. We've got a psychologist involved. He did an assessment. Here's what he said. But now what are the medications all about? Okay, and that's all they talk about. So I just was itching to get out of there. As soon as I got my registration, the administrator of the psychiatric unit knew I was gone. And in 88, October, I said, I'm going out on my own.
Wow. So you're here at RVH, though. I'm going to go back to that again. What sort of stuff are you analyzing? What sort of stuff are you being utilized to understand and to get to know?
Well, my input was more on doing psychological assessments with tests.
Okay.
That's unique to psychologists. We are qualified to administer a lot of well-researched instruments, and so that was mainly what is the testing material, what's the objective findings, as opposed to psychiatry. It tends to be more subjective. They look at you, they talk to you, say, okay, I think he's this. Whereas we would say, yes, we think he's this. How does the research support it, or does the behavior support the research? So that's sort of our expertise area.
So you're digging a little deeper.
Yeah.
Okay, and you're patient, so it takes a little bit longer.
Yeah, you have to.
Okay, so then you decide to go out on your own. How did that progress?
Well, just, I hate to say it this way, listening to the attitudes that the medical profession had towards psychology. We would sit there, and it was like tokenism. We got a token psychologist here, so we will use them. And even the guy that replaced me didn't last that long. He was itching to get out. As soon as he got registered, he got out. Mm-hmm. Hospital systems are hard because you've got a system in there that is unyielding. They see mental illness as a biochemical imbalance. And as soon as you say that, everybody thinks, okay, so you just balance the chemistry? Oh, okay, give me the pill. But there's lots more to it.
Well, people treat people like they're a hot tub and they can just adjust their pH. And it doesn't work like that.
No, it doesn't.
No. So I kind of get what you're saying with that, because, well, honestly, a hospital is a business too, right? And their job is to get in and out, get them in and out, because more people are lining up, especially in Ontario, right? So doing what you're doing, again, big respect for what you're doing. You go out on your own. How did that happen? How did you find people, or I guess how did people find you?
What I did is I started, a year before I left, I started to do hours after work. So I was doing 10 to 15 hours on top of my 37 hours at the hospital. And I started creating a flow of people. Mm-hmm. When I finally was going to leave, I made an announcement, sent it to all the lawyers. I'm in private practice, blah, blah, blah. Here's my number, call me if you need these kind of services. Well, for those first couple of years, I did a lot of custody and access assessments, which were brutal, really hard.
Yeah.
And the lawyers were just looking for anybody who would do them and give us some reports. Mm-hmm. And you're looking at 10, 15, 20, 30-page reports. Mm-hmm. So they were tiresome, tedious, and a lot of lying in some cases. One person would say this about one partner, this partner would say something about that partner. And you're trying to write a report, trying to say, okay, what's best for the kids? Sure. So I got out of that and slowly got into WSIB work, insurance company work, where they would send someone needs help and they've got some limited coverage and they come in.
Sure.
I started doing some kids, loved doing kids. Then all of a sudden, out of nowhere, some people started calling me a child psychologist, and I said, "Well, I am a child still, but I didn't qualify for that. Like, I didn't train to be a specific child psychologist, although my education in education opened and exposed me to some things there.
But I think the experience that you would gain doing enough of those cases would give you that sort of hands-on experience that maybe a school could never really necessarily
that's very much one of my philosophies is that there's no negative in life. There are opportunities to learn and grow, and if you don't take those opportunities, then it can become very detrimental to you. But if you see everything happening in your life as just another opportunity to learn and grow and take you to the next step, which you may not even know what it is.
Well, those child case studies must be interesting as can be, because when you think about those, honestly, if you've got two parents who are putting on the best show they can for somebody who's going to basically assess where the child should live, and then you've got the children who, they're being affected, they're being pushed, pulled, maybe bullied, maybe coached. There's a lot of stuff going on, and you have to pick up on all those things.
That's why I got out of it. I did 30 of them, and then I just said, this is not my comfort zone, not my area. There's other people that thrive on doing them, other psychologists. So I said, let them do it. And it's become a lot tighter now. To do a custody and access, there's a lot more required view of a psychologist because the legal system is heavily involved.
Well, to me, it's kind of like social media a little bit too, right? Facebook, everybody's presenting what is the best about themselves.
Yeah.
There's a whole other dark side down below all the person typing that stuff.
Yeah.
So you have to be able to sort of psychoanalyze, I guess. Is that the right term?
Well, you got to try to figure out what is truthful and what you can support. It all comes back down to when you write a report, you have to be able to back up what you're saying. So why did you say that he's paranoid? Well, in our conversation, he kept looking over his shoulder and checking the door if anybody was listening. I think that is somewhat paranoid.
Are there certain words that you find bother you? Because I know that, and this just came to me just now, is, you think about people psychoanalyzing, people throw the word psycho around or retarded or words like that around. Do you ever get really offended by those words?
Well, I get very angry and feel very badly because mental illness has been put into a special box that if you have mental illness, whoa, don't go near him. You're a knife slasher, you're an axe murderer. You'll be raping, pillaging, and that. So you watched Freddy Krueger, you watched Nightmare on Elm Street. These Halloween 1, 2, 3, 85, 90, whatever it's out there. The media portrays mental illness as dangerous, as unpredictable, as violent, as malviolent. So people are afraid to come to us. Don't tell anybody I'm seeing you.
Stigma.
And why I was always thinking, why don't we have a mental health exam, just like we have a regular health exam? We're encouraged, every so many years, have a health checkup. Why don't you every so many years have a mental health checkup? Just to see if there's somewhere we can help you a little bit. There's something you missed, some support that you're missing, you need. We don't do it.
But it's that stigma, right?
Yeah.
And people think that politicians are now going to tag you, or there's the big brother issue that somebody's going to be like, oh, these 3,000 people in Barrie are in a category orange, whatever they want to category it as. They're clearly developmental issues or whatever. And I think maybe that might be the fear, right? Is people might be worried they're going to be categorized.
Well, even another fear, maybe this is conspiracy theory stuff, but one of my concerns is they're talking about chipping everybody. And I think that's such an intrusion into our privacy, and yet here's how they sell it. You want us to find your daughter or your son when they've been kidnapped, we could have them in 5 minutes. We will know where they are, boom. Then I thought, but the guy that's kidnapping, if he's had enough exposure to understanding what chips are about, he's got a chip reader. Oh, there it is. Sure, take it out now. I'll leave it on a doorstep somewhere, and off I go.
Yeah.
We got to be careful that sometimes the medicine is more of a poison.
I get that.
So
you go from all this sort of assessment stuff. What would you say you enjoy assessing the most? Is there something that you feel that you've more found an expertise in, or something that you specialize in that you really have embraced?
Well, what we really enjoy doing, and it's partly because I'm ADHD. I'm learning disabled. I got ADHD, I got Erland's, I've got dyslexia. Probably a couple other learning disabilities if you assess me, and still I got a PhD. I love working with kids when we were doing psychoeducational assessments because I give them hope. I say, listen, I can't read. I have to wear my lenses, my Erland lenses, so that the words don't jump around. I have to do some deep breathing to slow myself down and slow my talking down because as soon as I get excited, my tone elevates and the speed elevates. So I have to always watch my words and slow down. No one notices it except I can feel that pressure inside of me wanting to talk faster. So doing kids and walking, I'll give you a story, and this is, I assessed a kid in grade 3, and he was sort of borderline intelligence, a nice kid, came from a broken home. His mother was, she was taking care of him, the father was involved somewhat. So I assessed him in grade 3. between grade 3 and grade 5, when he was going to go into high school, she comes back and when he's in grade 8 and says to me, can you assess him so that we can give the high school some accommodations so he can get through high school? I said, fine. We assessed him. But by then, I had learned about Irlen syndrome. I had learned about auditory processing disorder. I learned about a bunch of new things. So when I reassessed him, I said, have him tested for auditory processing. Well, when I tested him, he could hardly hear the teacher speak. It was all noise and distracting. So he had to wear a little FM receiver. And the teacher had a transmitter with a little microphone. Every class, he'd give it to the teacher, sit down, he could hear everything. So that's one thing. Then we found out that he had profound Irlen's, where when he was reading, the reason he couldn't read is that words were jumping up and down. Stuff was moving all over the place. So they got him lenses. And
they're a colored lens, aren't they, or something? Yeah.
They're just a plastic, the right color, though. And so when he started to read, it went from this, puts the lens on, and it just smoothed out. His mother was in tears. She couldn't believe it. So then I lost track of him. He went to high school. I get a call about 2 years ago, and it got me. I was teary when she was telling me. He graduated from high school, whatever level, gets into Georgian, so you have to have a certain level.
Sure.
Took 2 years at Georgian, and then got accepted at York University and gets a BA. Now here's a kid in grade 3 that some people might have said, we'll just keep him in this slow learner program because he's not going to amount to much.
Or he's a Ritalin kid, or other things that people want to just, here's a needle, here's a pill.
Well, the mother phoned me, told me, and I'm just saying that's wonderful. I've had a few stories like that with kids that we've worked with, because we give extra when we do the psychoeducational assessments. They're getting a binder now of suggestions of things they can investigate to help their child with learning.
And it's funny because I think maybe it's not even going to be so much the child who is concerned about being assessed or going through these sort of things or these studies, it's the parents.
Yeah.
The parents don't want to be, where's Billy? Why isn't he at soccer? Oh, well, he's at a study. They might take it as they did something wrong.
Yeah.
Or they've created something that how can we have created this? It's not a mistake. It's something that's going to, the child needs to just be assessed.
And it's sometimes the lack of knowledge. They come to me and say,
ignorance.
What do I do? What are strategies? Mm-hmm. Well, if you look at the report I produced for that kid in grade 3 and what I produced later on, like it was night and day. Like all these recommendations, here's you can do this, you can get into these resources, that resource, and the parents love it.
It's funny because it's taken me time just even sitting here with you. I tend to be a little ADHD too, and there's been bees and butterflies floating around here, and I'm trying to keep in contact with you. And I'm like, these things.
I'm with
Squirrel.
You though. I have to watch the flower over there will catch my attention while I'm talking to you. So I've got to really work on focusing.
That's nice. We'll just point the camera. We'll have 5 cameras on us. Nice. So let's back up or kind of change direction here a little bit. So the children aspect, I love that. I think it's great. Being a dad, that's wonderful that you do that. So again, thank you for doing the stuff that you do. Let's talk a bit about the heavier stuff, though. You're no stranger to TV as well, too. You've been part of national crime cases and big deals and big horrible things. I know you can't talk about some things due to the Privacy Act, but there are some things that maybe you could share with me. What are some of, and be right open with me here on this, what are some of the scariest things that maybe made you have a hard time sleeping or trying to shake off? What have you had to deal with?
I haven't been involved with any murders or anything like that. Missing kids. There was one famous one in Barrie around Thanksgiving, and they call on me a number of times. They come in and comment, why, what influence is this? How is he going to, is he going to be alive? Is he just a mad little kid that took off? But he wasn't alive. They found him, but he wasn't alive. And so it was that pulled at my heartstrings. When I see traumatic accidents that I might have a bit to do with, maybe assessing a child or an adult after a motor vehicle accident or after a horrific work-related accident, those affect me, and I have to really turn those off. The way I turn them off is I do the other things that I love, not just psychology, my life.
Yeah.
My wife and I used to sing and travel. She's doing most of the singing now because I'll get back into it maybe, but I'm an artist.
Yeah, tell me about this. So you've got lots of art inside your home.
Yeah, over 100 pieces hanging up.
And so what's your specialty? What do you like to do?
Paint.
You like to paint? Well, do you have a particular motive? Or?
Well, watercolor in the last 7 or 8 years has been my passion because watercolor is one of the hardest mediums to work with. And so I determined that I'm not going to avoid it anymore. I'm going to go headlong into it. I did, and I produced like 100 watercolors. And I've shown them at Kempenfest. I've done art shows. I'm known as an artist as well. A lot of people don't believe it because they say you're a hockey player also, an athlete, you do sports, and you paint? Or you're a psychologist and you paint? I said, what's wrong with that?
You don't always get a jock who can do art, right? Or maybe they're too jock to want to do art, right? Tell me about let's go back to the art again, and I'll ask you more about sports. So, your favorite things to paint are what? Like
landscapes. I'm basically a landscape artist. I do pretty good still life flowers, but to me they're boring and tedious. So I paint them to satisfy my wife. So I do a few of them, but then I love landscapes. I like capturing the images of what through the artist's eyes you're seeing, because you see a lot different things. And one thing I'm learning, and it's a slow process. The colors that you look at are not the colors you're going to put on your canvas. Not
necessarily.
You know, you got to look at different shades and that, and there's nothing incorrect with watercolor. I teach people, if they want to learn watercolor, paint for your own self. Don't worry about what anybody else does. Paint and grow within yourself. And that's what life is all about. Learning, taking all the opportunities and learning to grow from them. That's so important.
And that's therapeutic too, for the soul.
Oh yeah.
For the soul, it's something that a lot of people just can't touch, right? So art's great for that.
I can't leave out writing. I've published a couple of books. I've got one called Alex Chronicles, and it's about an ADHD turtle. And it's a funny book. Everybody that reads it loves it, and at the end we do a therapeutic technique called tapping. And we're still working on trying to get a video with the kids singing it, but that may never happen. But for some reason, people love the book, and I've had kids come up to me and say, "When's the next book coming out?" Because I got an ODD bear comes into the picture, so oppositional defiant disordered bear, and somehow we got to help him meet Alex and take care of his issue, you know. So
that's
and
great.
then I got a couple of art books with my art in it.
So then let's go back to the sports thing too. So right now you're nursing a bit of an injury, and that's probably sports related, right?
Yep.
You've done quite a bit of sports. You're a hockey junkie, it sounds like.
Yeah, I did a lot of that.
I don't want to say junkie to a psychologist, but you know. But tell me a bit about your sports. What do you like to do?
Well, in high school I pole vaulted and
you pole vaulted. So not a lot of people say they pole vaulted.
Well, I went over 11.6, and then after that I think my brain got scared, couldn't get any higher. But I played hockey, I played football. I played tennis. Didn't do bad in tennis. I could, if I would have concentrated in any one sport, I could have gone a lot further. But that wasn't in the cards. You know, it was more the idea. I just love sports. I like to learn. I play golf. This may be reduced to what I can do now with this injury. It's just golf. I don't know.
Yeah.
And I played some low-level college hockey, just a little bit, not much. Played one summer with some semi-pros in California because I was there on water.
Fun. That's fun.
That was wild.
Yeah.
But
so on a therapeutic basis, then, what are you doing that's just for you too? Other than that, you've got how many children? Two. Okay. And how are they involved in your life? You've got grandchildren. You must have a lot of fun with grandchildren.
Well, the grandchild, we got the one, and he's a hoot.
Yeah.
I'm relearning the developmental stages and watching how fast he's developing in some areas and going, oh, I don't know if I developed that fast. Yeah, well, I didn't know if I developed that fast. But
I saw a great old quote that said, if I'd have known grandchildren were going to be so awesome, I would have had them first.
Yeah,
right?
Yeah, grandchildren are right, because you can give them back. But with us, my daughter lives with us, with the child, so we're getting spoiled.
That's good.
We're kind of, you hear him yelling from the downstairs where he's sleeping. He's yelling up the stairs, "Where are you, Papa?" And then you thumping up, so... That's a joy.
Fun.
That's fun.
That's family. Family's great.
Yeah, my son's a gymnastic coach and instructor, and extreme martial artist.
Wow.
He's working in Toronto. In Newmarket. He's hoping to get a couple of shots at stunt work in movies. He's got good connections. That may happen.
Very cool. Well, we actually had a stunt guy on our show once. It's pretty interesting content.
Well, and it's dangerous. It's risky.
Very dangerous.
Boy, these guys have to have good insurance.
And you can't even pretend to be injured or that you're not injured, because sometimes you're just injured and that's it. And they don't want somebody who gets injured, because that's another liability.
Yeah, yeah.
So when you're not doing this, what is a message that you would want to give to people about you, or maybe something people don't necessarily know about you?
Well, we try to counsel and talk to people from life experience. I try to be transparent as much as legitimate and appropriate. I want people to understand that it's a process, and that I'm with them through the process, and they can come as often as they want, as little as they want. Always recognize that if things aren't working, look at yourself first. Don't point at the therapist or a counselor or a psychotherapist. Look at yourself first. What opportunities are you missing to learn and grow? I had a cousin who divorced his wife, and she took 2 years after the divorce to find herself before she even began to date. I see too many people who get a one relationship, pop into another one, have changed nothing and wondered why it doesn't work. So I want people to take time to understand and know themselves. There was a saying, and I think, I can't remember who said it now, but it said, the two most important days of your life is the day you were born and the day you learn why you're here.
That's a good message.
Yeah.
Because there's a lot of people who I think they repeat cycle, next relationship, same cycle, same cycle. It's like people who don't know how to either forgive people around them or forgive themselves.
Yeah.
And they get this incredible guilt.
Yeah.
And they get this incredible anxiety. And, you know, people say that cancer is caused from food and from all these things. There's a lot of things that can cause cancer and other, you know, problems with the body.
Stress is a big one.
But talk about those things, and that's in here. You know, it's like saying, people are sitting there and they can't get over it. Their heart hurts.
Yeah.
But hearts heal before your mind does.
Yeah.
You know.
Yeah.
So, what's something that you would tell people to wake up? You know, to figure out.
Well, I think we need to take time for ourselves. We need to take time to reflect. I think we move so fast, and now with all the technology, you can't get away from it. Anybody can find you anywhere, anytime. And we need solitude. We need time to. Some people don't know what to do with quiet. Even in a conversation, if there's a poignant pause, somebody wants to put something in there because they're getting uncomfortable. Nothing's being said. Sometimes you need to think. God gave us a good brain. We need to nurture it more. We need to feed the brain more, and that means nutritionally, through exercise, through reading. And if you can't read, if you're not a reader, like I'm a dyslexic and ADHD, it's hard to read. So I've developed my own style of reading, so I get what I need out of every bit of information. Movies are great for me because I can find lots of principles in movies, sayings and situations, and I can bring it to the therapeutic table and say, you remember that movie? Did you see how? Yeah. Remember what happened there? That's you. Oh, I never thought of that. Because they're there for entertainment. They're not looking. I look at two levels. I love the entertainment side, but I'm also keeping a part of my brain focused on, could use that next time.
Interesting. So it's funny because that solitude is something a lot of people need to do. And so when you're speaking for a child, for example, do you find that a lot of kids can just be quiet?
No, you got to keep moving. You got to keep it active. You know, I tell parents, they send me a 10-year-old and I say, that 10-year-old is not going to look at me and say, well, Dr. Marek, I've got this existential problem that I've got to solve. Can you help me? I'm saying to the parents, when was the last time you heard your child say that? Well, never. Yeah. So I play games. I have them do drawings. We go for walks. When this is a bit better, I usually take them down between the houses down to Tim Hortons. We sit over a bottle of juice and chat on the way back. It's interesting the kind of stuff you get out. Maybe nothing, but maybe a lot. And that's what, when you bring children to me, you got to be patient.
Yeah.
Adults usually pull the plug because they just aren't getting fixed fast enough, but they're not listening either.
Okay. So share a message with the people that are watching the show today, because there's a lot of people who are fascinated by you, and honestly, we're only scratching the surface of Ken Marek today. So if there was a message for people to understand, to get over the stigma of depression, or the okay to go to a psychologist to get an assessment, especially for children, what would you tell the parents to help them get over that stigma? Because it's the parents, I think.
Well, yeah, I think so. I think what the problem is that it's been misrepresented out there, mental illness in ways. So what we've got to do is people have got to say, I need a change. I need to take control. And mental health assessments and that kind of things, they're an opportunity to learn and grow. So look at anything that comes in as how you're learning, how you're growing. And that, I think, is the message you need to. If you want to grow, don't assume that because of your circumstances you cannot go anywhere. Most 8 out of 10 millionaires were bankrupt at some part of their career before they became billionaires. And we have to fail ourselves to success. Take no as a vitamin.
Well, I think that sitting with you, you're definitely a good peer and a good mentor for the community and for anybody who gets to know you. So I want to thank you for being a guest on my show today, Dr. Marek. You're definitely inspiring.
Thank you.
Thank you.